Good to see you here. We're in a place in Sardinia here. Day after the Congress of the AIO, the Italian Association of Dentistry. I'd like to take the opportunity to ask you some questions about implant dentistry, safety in implant dentistry, and more predictable outcomes. So, first of all, you are one of the most renowned interviews on social media. You've seen so many KOLs, and I would love to turn the table today and ask you about your opinion about why you think clean implant might have a voice for more safety in implant dentistry.
Sure, thanks, Dirk. I appreciate it. A long time ago, I was taught a very simple fact about success. Your objective is 100%. 100%. The problem is achieving 100% is extremely problematic. Mm-hmm. There was always an X factor. The X factor is any combination of things. We generally associate it, or dentists are accused of their technique is not right, their protocols are not right, their diagnosis isn't right, their treatment plan isn't right. But there's a specific reality to all this. The products that you use have to be not only impeccable, but unimpeachable. So I've gotten to know you. I understand what Clean Implant Foundation is about. I understand your just extraordinary dedication to what you're doing, the effort that you put into analysis, non-biased analysis. There's no prejudice in what you do. This is strictly your vision, your passion, your commitment. So what I've seen in watching your material is that when you get microscopically, which is where the osteocytes are, okay?
Absolutely.
That's where those osteocytes are. When you get microscopically and you can see these carbonaceous compounds and residual plastic from the packaging and this sort of stuff, you kind of look at it and you go, if you're talking about 100% success and you've already created a condition where it's impossible, before you even put the implant in, you've done all these wonderful osteotomies and tissue grafts and bone regeneration, and then you're putting in a dirty implant. Now, granted, it's not dirty, but by the same token, given the incidence of peri-implantitis and perimucositis, you have to find even the smallest factor that can negate success or cause some type of, dysfunctional response. So we're looking at people today who have their compromised health, their comorbidities, potentially they're smoking, although much less so, thank God. But the reality of it is your patients are not perfectly healthy. Every factor you add into the equation nullifies the success rate.
If it's avoidable.
If it's avoidable. There you go.
It is. You cannot deal with the diabetes of the patient in
No.
the end, but you can choose an implant. In my personal opinion, that is where we see all these contaminants, impurities, give it a name, are technically avoidable. And that is the thing.
Mm-hmm.
That we're showing. I think we should demand as dentists more than just simply accepting any promise that has a big question mark in the end.
Well, you just said an interesting word, accepting. Your patients have to trust you.
Exactly.
So they accept the fact that everything you're doing on their behalf is pristine. Everything you do is done with exquisite finesse. And if the part that you're putting into their body, if you're now adding a piece to their body and it isn't pristine, are you as consummate a practitioner as you feel you should be? Are you seeking excellence? Are you seeking to do the best care for them? And I don't know how you can answer it any other way than no. So you, as a clinician, we must depend, in the same way we pay for the privilege, the patients pay us for the privilege.
Exactly.
That supply chain needs to be ideal, perfect, and delivered on time. The only way you're going to do that is if the product you insert is ideal. Then everything else just falls into place, because that's where it starts. You're putting it in the bone, everything has to heal to it, tissue has to adapt to it, whatever. But if that part is faulty to begin with, the car don't run. Okay? I don't care, Ferrari, you got bald tires, you're still going to slide off the side of the mountain. That's the bottom line with the Clean Implant Foundation.
Thank you, Ken. I
it's
know
a
it was
pleasure.
a good idea to ask you about
Oh
that.
yeah, because I'm so whatever. Come on, I'm not an implantologist, but it makes sense. I don't care what you do, endodontist, prosthodontist. There's a logic to being ideal. That's our goal. People pay us to be perfect. So be perfect.
Thank you.
Okay.